Good afternoon, everyone. Welcome. Thank you all for being here today, hanging out with us today, and talking about living well with chronic conditions. Just a couple housekeeping things before we get started, because there are multiple people here with us today. We do ask that you please keep your microphone and your video off. We will be utilizing the chat feature or that Q&A function at the bottom to ask any and all questions that you might have for Meagan. We will have some time at the end of our presentation today to answer as many of those questions as we can. If we don't get to all of your questions, we will include answers to the questions that you ask for us in an email, and that'll include the recording to this video as well. So again, feel free as Meagan is presenting to put those questions in that Q&A option at the bottom of your screen, and Meagan will answer them all at the end. Now we're really excited to have Meagan here with us today. She's a health educator here in our department at Providence Community Wellness. And with that, Meagan, I'm going to pass it off to you.
Great. Thank you, Erica. Welcome to the Living with Chronic Conditions presentation on recognizing the mind-body connection to cope with chronic illness. As Erica said, my name is Meagan Chapman, and I'm a health educator going on 8 years with Providence Community Health and Wellness. I teach a variety of health and wellness programs here, including our weight management and diabetes prevention classes, as well as our mental health first aid classes, and I'm a master trainer of the chronic disease self-management and diabetes self-management workshops. For this presentation, we will define chronic disease, discuss the symptom cycle, review our role in treating a chronic health condition by focusing on 4 thinking type activities, including distraction, relaxation body scan, helpful thinking, and guided imagery. I'll be demonstrating 3 exercises that you may choose to follow along and partake in, or just listen. At the end of today's presentation, we will reflect on 3 resources to remember, 2 things you learned, and 1 action that you will take as a result of today's presentation. You may want to have a pen and paper for taking notes, and as Erica mentioned, we will be sending out an email to all of you in a few days with a link to this recorded presentation in case there's anything you missed, as well as links and an information handout to all the resources mentioned today. What exactly is a chronic disease? Health problems can be characterized as either acute or chronic. Acute health problems usually begin suddenly and often are easily diagnosed. They last a short time and get better with medication, surgery, rest, and time. There's usually relatively little uncertainty for the patient or the doctor. Appendicitis is an example of an acute illness. The diagnosis of appendicitis leads to surgery or removal of an inflamed appendix. There follows a period of recovery and then return to normal health. Chronic illnesses are different. They usually begin slowly and proceed slowly. For example, a person may slowly develop blockage of the arteries for decades and then might have a heart attack or stroke. Unlike acute disease, chronic disease usually have multiple causes that vary over time. They may include heredity, lifestyle, and exposure to environmental factors like secondhand smoke or air pollution, and to physiological factors such as low levels of thyroid hormone or changes in the brain chemistry that may cause depression. These causes and unknown factors can be frustrating for those of us who want quick answers. As you can see, there are many examples of chronic disease, and there are many more that are not listed on this list. Any condition that lasts 1 year or more and requires ongoing medical attention or limits activities of daily living, or both, is a chronic illness. And a person may be experiencing more than 1 chronic illness. Also, it's important to note that anyone who's living with someone who has a chronic condition will find today's presentation helpful. Let's look at the symptom cycle. These are a few examples of symptoms that people with chronic illness or someone living with a person with chronic conditions experience. This example is listing poor sleep, physical limitations, pain, stress and anxiety, difficult emotions, depression, shortness of breath, and fatigue. Unlike acute disease, where full recovery is expected, Chronic illness usually leads to more symptoms and loss of physical or mental functioning. With chronic illness, many people assume the symptoms they are experiencing are due to the disease itself. While the disease can cause pain, shortness of breath, fatigue, it's not the only cause. Usually symptoms can contribute to other symptoms, and the symptoms can feed on each other. This is a vicious symptom cycle. For example, depression causes fatigue. Pain causes physical limitations, and these can lead to poor sleep and more fatigue. The interactions of the symptoms, usually symptoms can contribute to other symptoms, and the interactions of these symptoms make the condition worse. It becomes a cycle that can only get worse unless we find a way to break the cycle. The thoughts you have can greatly determine what happens to you and how you handle your health problems. Some of the most successful self-managers are people who think of their illness as a path. This path, like any path, goes up and down. Sometimes it's flat and smooth, at other times the way is rough. To negotiate this path, one has to use many strategies. Sometimes you can go fast. Other times you must slow down. There are obstacles to negotiate. In this presentation, we will examine ways of breaking the cycle and getting away from the problems of physical and emotional helplessness. Now we'll look at different types of treatments and techniques to help with chronic illness. First, it starts with using medications safely and effectively and working with your healthcare team on how to seek medical help and what treatment to try. Maintaining a healthy lifestyle with regular physical activity and healthy eating. Adapting social activities and problem solving as your disease gets better or worse. Also, having sound sleep habits and managing stress adequately. Next, talking about your illness to family and friends and using community resources. And finally, using your mind to manage symptoms. The mind is a very powerful tool. To demonstrate how your mind can affect your body, we're going to do our first short activity. Remember, you may partake in this activity or choose to listen. So, please close your eyes and get comfortable. Imagine you're holding a big, bright, yellow slice of lemon. Picture it in your mind. You can feel the texture of the lemon rind in your hand. Now, lift the lemon to your nose. You can smell its strong citrus aroma. Next, bring the lemon slice to your mouth and take a big bite of the slice of lemon. It's juicy. The juice squirts all through your mouth. You can taste the tart lemon juice filling your mouth. The juice dribbles down your chin. Taste the juice from that lemon. All right, you may now open your eyes. And for most people who experience this activity, will start to salivate and pucker at the thought of the lemon, or when they are holding the lemon, smelling, or tasting the lemon, even though there's no lemon here. This is a simple example of how the mind can affect the body with very little effort. So we do have some caution when we are talking about thinking type activities. We don't want to use these thinking type activities with possible signs of a heart attack or stroke. None of these techniques should be used to overcome chest pain or sudden numbness or weakness on one side of the body. These are warning signs. a possible heart attack and or stroke and should be immediately reported and need medical attention. Let's begin with distraction. The lemon demonstration is an example of distraction, which is any activity that helps redirect your mind off your current emotions or pain. This demonstration is also referred to attention refocusing, which allows someone who's experiencing symptoms of pain or worry to help lessen the overwhelming sensations of a new or worsening symptom or health problem. You are not ignoring the symptoms, but choosing not to dwell on them. Today, we're going to review short-term distraction to help us manage our symptoms. Because the mind doesn't focus well on two things at the same time, we force our mind to think about something other than the symptom, so the symptom will feel less intense. Distraction is good to use when we have to do short activities that cause us trouble, such as pain, discomfort, or anxiety. Some examples are climbing the stairs or doing some routine chore. Short-term distraction can also help with troubling thoughts, or even when we experience shortness of breath. Here are 3 different examples of short-term distraction. You may want to try thinking of a person's name, a bird, or a flower, or anything that begins with each letter of the alphabet. Or challenge yourself to count backwards from 100 by 3. So 100, 97, 94, and so on. Or you may want to try to remember all the words in one of your favorite songs or the events in an old story. Some other examples of short-term distraction is using the stop technique. If you find yourself worrying or entrapped in endlessly repeating negative thoughts, then stand up suddenly, slap your hand on the table or your thigh, and shout, "Stop!" You can practice this technique whenever our mind endlessly repeats negative thoughts. Also, you might want to redirect your attention to a pleasurable experience. It also may help to look outside at something in nature, or try to identify all the sounds around you. You may want to massage your hand, or smell a sweet or pungent odor. There are many variations to do these examples, all of which help you refocus your attention away from your problem. Remember, these are examples of thinking type activities to help with short periods of time. And there are many forms of physical activity type distraction techniques that you may also do. And these are also very helpful in managing your symptoms. We have our first list of resources here that will help with distraction. A few websites you may want to try are the Pain Management Network, the Happiness Project, or the Greater Good Science Center. A few suggested reading books are the Wellness Book, The Comprehensive Guide to Maintaining Health and Treating Stress-Related Illness, or Inner Peace for Busy People, 52 Simple Strategies for Transforming Your Life. All the resources that we are listing today will help with all the different thinking type activities discussed. And remember, you'll receive an email with a link to this webinar, and you can go back and write these down if you don't have the time to write all this right now. We now move to the relaxation body scan. This exercise can enhance the quality of rest, ease painful muscles, and help with shortness of breath. It relaxes not only the mind, but the muscles. To relax, you need to know how to scan your body and recognize where you are tense. Then you can release the tension. To demonstrate, we will together practice a short relaxation body scan. As you get into a comfortable position with both feet on the floor, allowing yourself to begin to sink comfortably into the surface below you. Allow your eyes to close gradually. From there, turn your attention to your breath. Breathing in, allowing the breath gradually to go all the way down to your belly. And then breathing out. And again, breathing in and out. Now allow your attention to focus on your feet, starting with your toes, noticing whatever sensations are there. Warmth, coolness, whatever's there. Simply feel it. Imagine that as you breathe in, the breath goes all the way down to your toes, bringing with it new, refreshing air. And now noticing the sensation elsewhere in your feet. Not judging or thinking about what you're feeling, but simply becoming aware of your experience of your feet as you allow yourself to be fully supported by the surface below you. Next, focus on your lower legs and knees. These muscles and joints do a lot of work for us, but often we don't give them the attention they deserve. Now breathe down into the knees, calves, and ankles, noticing whatever sensations appear. See if you can simply stay with the sensations. Breathing in new, fresh air as you exhale, releasing tension and stress, and allowing the muscles to relax. Now, move your attention to the muscles, bones, and joints of the thighs, buttocks, and hips. Breathing down into the upper legs, noticing whatever sensations you experience. You may become aware of the contact with the surface beneath you, or perhaps the pulsing of your blood, whatever is there. What matters is that you're taking time to learn to relax. Deeper and deeper as you breathe in and out. Move your attention now to your back and chest, feeling the breath fill the abdomen and chest, noticing whatever sensations are there, not judging or thinking, but simply observing what is right here, right now. Allow the fresh air to nourish the muscles, bones, and joints as you breathe in, and then exhaling any tension and stress. Now focus on the neck, shoulders, arms, and hands. Inhaling down through the neck and shoulders, all the way down to the fingertips. Not trying too hard to relax, but simply becoming aware of your experience of these parts of your body in the present moment. Turning now to your face and head, note the sensations beginning at the back of the head, up along your scalp, and down into your forehead. Then become aware of the sensations in and around your eyes and down into your cheeks and jaw. Continue to allow your muscles to release and soften as you breathe in nourishing fresh air and allow tension and stress to leave as you breathe out. As you drink in fresh air, allow it to spread through your body from the soles of your feet all the way up through the top of your head. And then exhale any remaining stress and tension. And now take a few moments to enjoy the stillness as you breathe in and out. Awake, relaxed, and still. As the body scan comes to a close, you are now coming back into the room, bringing with you whatever sensations of relaxation, comfort, peace, knowing that you can repeat this exercise at any appropriate time and place of your choosing. And when you are ready, open your eyes. As with any new skill, we need to give this a good try, at least 3 or 4 times in the next 2 weeks before deciding whether or not we like it. We have a few relaxation body scan resources for here to show. First is a YouTube link, and it has relaxation body scan under this exact link. If you go to YouTube and search in the YouTube or just anywhere on your browser, a relaxation body scan, you'll find a number of resources, but this is a nice one here. Also, the body scan meditation script and practice website. A few books you may want to try is Teach Yourself Relaxation or a 1-moment meditation. Also, there's an audio CD called Relaxation for Mind and Body. This audio CD will also be suggested for our guided imagery activity in just a moment. Let's move to helpful thinking. Helpful thinking includes positive thinking and self-talk. All of us talk to ourselves all the time. For example, when waking up in the morning, we think, I really don't want to get out of bed. I'm tired and don't want to go to work today. Or at the end of an enjoyable evening, we think, that was fun. I should get out more often. What we think or say to ourselves is called self-talk. The way we talk to ourselves tends to come from how and what we think about ourselves. It can be important when it's a positive thinking or a weapon that hurts or defeats us, when it's habitually negative thinking. We can learn new, healthier ways to think about ourselves so that our self-talk can work for us instead of against us. Here are 5 steps you can use to help practice positive self-talk. First, listen carefully to what you say to or about yourself, both out loud and silently. If you find yourself feeling anxious, depressed, or angry, try to identify some of the thoughts you were having just before these feelings started. Next, work on changing each negative statement to a more positive one, or Find some positive statement to replace the negative one. For example, negative statements such as, I don't want to get up, I'm too tired and I hurt, or I can't do the things I like anymore, so why bother? Instead, try these positive messages such as, I'm feeling pretty good today and I'm going to do something I enjoy. I may not be able to do everything I used to do, but there are still a lot of things I can do. Or, people like me and I feel good about myself. 3, read and rehearse these positive statements. It's this conscious repetition or memorization of the positive self-talk that will help you replace those old habitual negative statements. 4, practice these statements in real situations. This practice will help the new patterns of thinking become automatic. And finally, rehearse success. When you're not happy with the way you handle a particular situation, try this exercise. Try writing down 3 ways it could have gone better, 3 ways it could have gone worse. If you can't think of alternatives to the way you handled it, imagine what someone who you greatly respect would have done. Or think what advice you would give to someone else in a similar situation. Remember that mistakes aren't failures. They're good opportunities to learn. Mistakes give you the chance to rehearse other ways of handling things, and this is a great practice for future crises. As you first do this, you may find it hard to change negative statements into more positive ones. A shortcut is to use either a thought stopper or a positive affirmation. A thought stopper can be anything that is meaningful to you. For example, a puppy, a polar bear, or a redwood tree. When you have a negative thought, replace it with your thought stopper. It may sound silly, but it doesn't hurt to try. Don't forget positive affirmations or a phrase that you can use every day, like, I'm getting better every day, or I can do this, or God loves me. Again, you use these to replace negative thoughts. And here are some more suggested resources. Some good websites is the Mental Health America, Live Your Life, or the National Institute of Mental Health. You may want to look at the books Introducing Positive Psychology, a Practical Guide, or Thanks, How the New Science of Gratitude Can Make You Happier. Lastly, today we'll discuss guided imagery. You may think that imagination is all in your head, but the thoughts, words, and images that flow from your imagination can have a very real effect on your body. This technique is like a guided daydream. It helps to divert your attention, refocus your mind, and transports you to another time and place. Guided imagery and visualization focus on a particular image while using all senses to help the image even more vivid and powerful. So you're using all senses, like your sense of sight, smell, taste, and touch. You're always completely in control. You can project whatever thought or feeling you want onto the mental screen. You are the director. Typically, guided imagery uses a script either read by someone else or pre-recorded by you or someone else. Visualization does this and also allows you to create your own images. It uses images to create a picture of yourself in any way you want, doing the things you want to do. It allows you to divert your attention and refocus your mind away from your symptoms and transporting you to another time and place. And now we're going to take part on a short guided imagery demonstration together. Please close your eyes and get comfortable. And imagine yourself walking along a peaceful old country road. The sun is gently warming your back. The birds are singing. The air is calm and fragrant. With no need to hurry, you notice your walking is relaxed and easy. As you walk along in this way, taking in your surroundings, you come across an old gate. It looks inviting, and you decide to take the path through the gate. The gate creaks as you open it and go through. You find yourself in an old, overgrown garden. Flowers are growing where they have seated themselves. Vines climbing over a fallen tree. Soft green wild grasses and shade trees. You notice yourself breathing deeply, smelling the flowers, listening to the birds and insects. Feeling a gentle breeze cool against your skin. All your senses are alive and responding with pleasure to this peaceful time and place. When you're ready to move on, you leisurely follow a path out behind the garden, eventually coming to a more wooded area. As you enter this area, your eyes find the trees and plant life restful. The light is filtered through the leaves. The air feels mild and a little cooler. You savor the fragrance of trees and earth. And gradually become aware of the nearby stream. Pausing, you allow yourself to take in the sights and sounds, breathing in the cool and fragrant air several times. And with each breath, you notice how refreshed you are feeling. Continuing along the path for a while, you come to the stream. It's clear and clean as it flows and tumbles over the rocks and some fallen logs. You follow the path easily along the creek for a way, and after a while, you come out into a sunlit clearing where you discover a small waterfall emptying into a quiet pool of water. You find a comfortable place to sit for a while. You feel good as you allow yourself to just enjoy the warmth and solitude of this peaceful place. After a while, you become aware that it's time to return. You rise and walk back down the path in a relaxed and comfortable way. Through the cool, fragrant trees, out into the sun-drenched, overgrown garden. One last smell of the flowers, and out the creaky gate. You will leave this country retreat for now and return down the road. You notice you feel calm and rested. You feel grateful and remind yourself that you can visit this special place whenever you wish to. Take some time to refresh yourself and renew your energy. And now, preparing to bring this period of relaxation to close, you may want to take a moment to picture yourself carrying this experience of calm and refreshment with you into the ordinary activities of your life. And when you're ready, take a nice deep breath and open your eyes. Hopefully, this guided imagery demonstration helped to decrease any discomfort or tension. Also, you may have felt a little warmer because with the relaxation response, along with calming the mind and nervous system, it will increase circulation to our hands, feet, and to our muscles. Here are some more resources for guided imagery, including the websites City of Hope, Guided Imagery for Relaxation, and Health Journey Guided Imagery. Again, a few of these are YouTube links, and if you want to search on YouTube other guided imagery examples, you may do so, but here are a couple suggestions. Also, the book Head First, The Biology of Hope and Healing, and the same audio CD we used for the relaxation body scan, Relaxation for Mind and Body. Here are a few other techniques that you can use for the mind-body connection to help with chronic conditions. Mindfulness involves simply keeping your attention in the present moment without judging it as happy or sad, good or bad. With nature therapy, many of us suffer from what has been called nature deficit disorder, but it can be really cured with regular doses of the outdoors. You may want to just practice gratitude. Some examples include writing a letter of thanks, acknowledge at least 3 good things every day, and make a list of things that you take for granted. Also, you might want to compile a list of strengths. Make a personal inventory of your talents, skills, achievements, and qualities both big and small. Also, prayer and spirituality. There is strong evidence in the medical literature of relationship between spirituality and health. According to the American Academy of Family Physicians, spirituality is the way we can find meaning, hope, comfort, and inner peace in our lives. Our goal is to break the symptom cycle by using the mind-body connection. We do not have to use all these techniques mentioned here today. Rather, we may find 1, 2, or 3 things that work well for us. Once the cycle is broken, it is broken, but it often repeats itself, so we may have to break it again and again. When you have a chronic disease, too often the center of attention becomes your disease. But you are more than your disease, and life is more than trips to the doctor and managing symptoms. It's essential to cultivate areas of your life that you enjoy. Within the true limits of whatever disease you have, there are ways to enhance your function, sense of control, and enjoyment of life. All right, so let's go ahead now and reflect. And I hope that you made a note of 3 resources to remember from today's presentation, at least 2 things that you learned, and 1 action that you will take as a result of today's presentation. As a reminder, this is recorded and you'll receive an email with a link to view at your convenience in case you didn't get a chance to write down the resources, or you may want to share it with someone who could benefit from today's workshop on using the mind-body connection to help cope with chronic illness. Also, we have a number of upcoming events here at Providence Community Health and Wellness. If you would like to attend our Living Well with Chronic Conditions class, you may sign up under our course registration site That class will begin May 4th. It's at 9 a.m. It's a 6-week free program. And we will, once you are signed up, we'll be sending a link to attend the class. Also, we have our Prevent Type 2 Diabetes class beginning May 4th at 11 a.m., as well as a mental health first aid class on May 18th at 8 a.m., or a blood pressure self-management class beginning May 2nd at 9 a.m. Also, our next Lunch and Learn webinar will be the Nature and Mental Health and Wellbeing webinar on May 11th at noon. And for all of our class schedules, registration information, please call our office at 509-473-6007. You may also email us at wellness.wa@providence.org, or please visit our website at providence.org/community-wellness for a list of all of our programs. And with that, I will go ahead and ask Erica if there's any questions in the chat box.
Right. Yeah, thank you, Meagan. Thanks for that awesome presentation. We really appreciate you being here and doing that for us. Just as Meagan mentioned, we will be sending out an email in the next few weeks that will have a link to this recording via YouTube. And there were all those resources with our email and our phone number. And I'm also going to put in the chat in here as well a direct link for our registration site for classes. That has a list of all of our classes, as well as if you're interested in registering for any of those that Meagan had just mentioned, the more direct link I just put in the chat, and we'll also include that in the email as well. But of course, if you have any questions, you're more than welcome to reach out to us. And for questions, we just have one question for you today, Meagan. In your own life, what has been the best technique that you have used that you had talked about here today?
Thank you so much for asking that. I think that all these techniques are very helpful for various times. I'm a big fan of the short-term distraction and positive thinking. I think those can help immediately. I really like to use the relaxation body scan sometimes both in the morning or at night, just to help, I guess, before I start my day, or at night, just to help get to sleep a little bit better. The guided imagery can be really nice, especially when you think of a special place or time that you can remember, or you can also refer to these resources here today that are so nice. But one of my favorite is the short-term distraction, including naming a flower for each letter of the alphabet. I think that might be my number one that I go to.
Right, awesome. Vicki also just put in the chat, there's a question here. Is there a list of medications that are prescribed for various conditions that you would recommend, since you had mentioned that at the beginning?
Yeah, so that is another terrific question. So we talked today about the 4 thinking types of techniques and, I guess, tools to help with chronic illness. And then some of the other things we discussed at the beginning was using medications and working with your healthcare team effectively. I personally don't have any recommendations right now, but what I would suggest is talking to your team, talking to your healthcare provider and organization, and maybe reviewing your, for example, your My Chart, and making sure that you are up to date with your medications. It's good to review your medications often and to see if there's some that are expired. That's another great question. I'm glad you asked that too, because when talking about our Living Well with Chronic Conditions workshop coming up, our 6-week-long workshop, it's something that we address. And it's a very important tool on not only how to use medication, but how to work with your team effectively. Making sure that you ask the right questions, and also asking for clarification if there's something about a medication that you may not know how to use. Also, something that's really important with medications is to never just stop. Make sure that you talk to your team before you stop taking medication for whatever reason. Yeah, I would say definitely talk to your doctor, talk to your provider, and ask them, because there are, as we saw, so many different examples of chronic illness, and that means there's a lot of different examples of medications too.
Great. Well, that's all the questions that I have that I'm seeing here. And open, we've got one more. Linda is asking, do you have any suggestions for when you can't get help from your doctor?
Another great question. That can be a little bit frustrating sometimes when we're trying to work with our provider and our doctor and we can't see them immediately or work with them. So obviously, if it's an emergency, you're going to want to call 911. But if it is something that, like, for example, you need to address a medication or you need to address something related to your chronic illness, I would definitely reach out to friends and family and other resources and see if there's anyone else, like, for example, here in Spokane, Washington, I would see if there's anybody else that I could reach out to, talk to maybe somebody else in Providence, or just getting a phone number and say, I need to, there's something that's, it's not an emergency. I don't need to see a doctor in the emergency room for, but I do need to talk to someone the next couple of weeks. Who can I go to? And then see what other friends and family who they suggest for maybe a condition that might be similar to yours. It never hurts to reach out to people like you.
Well, thank you all for those great questions, and thank you, Meagan, for being with us here today. Again, if you have any questions or want some help registering for the next classes that we have, you're more than welcome to shoot us an email or call our office as well. We're more than happy to work with you on any of that. But otherwise, that's all that we have for you all today. Again, thanks so much for being here and hanging out with us today.
Sandra, thank you all for coming. I really enjoyed presenting with you this chronic illness condition, mind-body technique you today.